Thank you, Gautam, for organizing this wonderful conference and the delegates for coming in person and attending this conference in big number. Topic of today is lifestyle management. Does it improve your fertility rate? Do you actually even bother to look at some of the parameters which I am going to put it in front of you when you are doing it or when you are taking a patient for IVF? And I will explain a little bit that it's not only the clinicians, it's the patient. The patient came to you today who wanted a baby yesterday, and you are telling the patient that you will get the baby tomorrow. That is the difference in ART. You go to a dentist for a toothache, he removes your tooth, you pay him the money, the pain goes off and he feels fantastic. Correct? But when he comes to you, you tell him you have a chance of only 40% of getting the baby, out of which 30% is a chance that you will take the baby home with you. That is the irony. And that should be improved only by doing, at least by adding this particular sector of art of making babies in 2021. What are our patients doing actually before coming to us is what I am going to be showing to you. So what is lifestyle? Lifestyle is like bell bottom or a tight jeans or a fatela jeans or the t-shirts or the specs you wear, and you have more for the Western countries. So it's a habit or a conventional way of doing things. The lifestyle factors can be, first is mobile. Okay, so at the airport now, when you see in the lounge, 90% of the people are sitting down, and looking at their mobile, planning their baby by Google way. So the first month only they want to plan it by Google. So they will go to Google and plan the baby. Obesity, we never bother about obesity. Do we check the weight? Do we check the height? Do we calculate the BMI? No. Stress is a common factor. It's like for me also there is stress, embryologist also stress, patient also stress. Postponing the childbearing. When the M means to teaching the child M for mango, the lady is doing M for MBA. Then it's going to be difficult. And smoking alcohol and caffeine is something which is very, very important. So these are some of the lifestyle factors which are going to be important. One of them is lack of exercise and environmental pollution. So busy life in 2020, this is how the babies are being formed. And tomorrow in future, this is how the baby will be made. Mobile phones, truth is going to be like Coke. We know all the Coke is bad. We know mobiles are also bad. So what they say, mobile used in a trouser pocket can affect your sperm count. So what is the answer given? Okay, keep them in the shirt pocket so that when you die of heart attack and not of infertility. Okay? So this is the way mobile phone is going to be affected, and the truth is never going to come out. Truth is never going to come out. Why are we seeing patients in two different criteria today? Either PCOS or low AMH. Are we seeing normal patients today? Are we seeing the men with good counts? Where are the counts gone? Do we really ask these questions? No. Whatever is there, even if we get one sperm, is good enough for doing XC. This is the calendar method. Okay? So what is it? This is the first month planning. This is what they do in the calendar. Find out from the Google what is our fertile period, because the rest of the time they are very busy. They are very busy. When you ask the patient, when do you have, how do you have, what is your sex life? They say weekly. So when you take the history little more detail, it is actually WEAKLY. It's not weekly. So this is how of the month they calculate. And about sex life, please don't ask, because it's already been done, sir. We are had enough of sex. So does really our great grandfather in the cave after sunset had a daily routine of having sex? Does it really help? Yes, the science says now that abstinence less than 2 days for IUI improves the count, I result. But before that, we were telling, don't keep relations. All the gynecologists, no, don't, the husband also will not keep relation. This particular study in Netherlands, for 118 patients with abnormal sperm analysis, were to do 7 days of continuous ejaculation, no other lifestyle factors. 80% actually showed improvement in the sperm parameter. I'll tell you Google Calendar method. 14 days of abstinence, 14, 15, 16 day of sex under stressful condition, and after again 16-day abstinence. Because ovulation has happened, time is done, we have done our duty. 3 months it doesn't happen, they come to Gautam Kastagi, Prakash Trivedi, Kedar Ganla, and so on and so forth. And what they do, okay, let's evaluate. They don't tell them to go back. Because now you have come here, so we will start treatment for you. Stress significantly reduces the probability of conception during the fertile window, possibly through a sympathetic medullary pathway. Means what? The wife will call on the 14th day and the husband will tell, are you coming home early today? I have prepared fish for you, your favorite fish. Understood? So 14, 15, 16, 17th day, they will invite the husband home, have the conducive environment, and try to be very happy. But that man is getting stressed. Now he has to have performance. Today, tomorrow, day after, all the days, because he doesn't know when is the wife going to ovulate. Now comes obesity. Pizzas and, where do we keep our children's birthday party nowadays? McDonald's. What are we creating? Healthy, unhealthy adults at the age of 40 with diabetes by giving them McDonald's. So this is how our unhealthy atmospheres are happening, because Swiggy is our mother now. That's how simple. In 1990, the man had a flat tummy and a broad TV. Today, the TVs have become flat, the tummies have become broad. Obesity is, for a moment on the lips, forever on the hip. And the best part is, if you ask a patient, why you became obese? But she says, I don't eat anything, doctor. It's a common answer. If you ask us, he asks me, I don't eat anything. I eat this, I eat that. But how? I have no idea. What is it? If the BMI is between 30 to 35, before starting the IVF cycle, your rates of IVF are reduced by 30%. Now you take it. And if the BMI is more than 35, is reduced by 50% by this particular study. So why to do only IVF? First reduce the BMI. But we are scared, because if we tell to reduce BMI, she will go to the next door. The next door is not going to be bothered. He will do the IVF immediately. Before the patient says, it is done. Because the batch is starting next month, next Monday. So I want to take up the patient. Relative risk of infertility with rising obesity. See, the best part is, if you decrease your BMI by 1, your odds of conception increase by 1.1. Just by calculating BMI. So we have to move from this to this. And who is going to tell them? Person like me. What has he achieved in last 5 years? Not a single kg weight loss I have done. So I am going to tell them how to lose weight. This is about the lifestyle. Very common scenario nowadays in metropolitan cities, the outside barista coffee shop, girls are smoking away, reducing their ovarian reserve, and about sex life. So erectile dysfunction is absolutely very, very common nowadays. When the husband tells you that I want to speak to you personally, means it is understood, it's time for give them. This is what is happening to us. Intellectual progression, sexual regression actually. We are not interested, because the brain from the morning It's going up, down, up, down, up, down, up, down. Where is the time to think about sex? It's done. They're finished. At 35, they're finished. Done with it. Ask your patient, take an history. And this is how the Viagra works. This is how, you want to give them pregnancy, give them Viagra. Well, Viagra also can be given for lots of reasons, but one of the reason is for pressure anxiety. Smoking, okay? What does it do? Male infertility and smoking is like a perfect combination. You don't have to do anything. They will kill their own sperms. By giving antioxidant, it is not going to reverse anything. It's been proven. But still we give antioxidant, we will not tell him to stop smoking. Or the female, stop smoking, if she come to you for a postponing of the pregnancy, will not tell them. The ovarian reserve is finished with smoking. So, are we going to achieve anything? Cessation of smoking improves the sperm parameters. It has been shown. But do we have time? No, we do not have time at all. Natural reproduction, pregnancy falls, ovarian reserve falls, everything falls. But now we look at the smoking. But in India, there are people who are using tobacco in the form of the black masheri, and the guys are using left, right and center gutkas. Do we consider that? Do we have a single study on gutka in India and male infertility outcome? No. Alcohol, another thing, which actually is not a very big thing in the reproductive population, but from lower socioeconomic status, yes, it can cause decreased follicular genesis, and in abroad, especially in European population, it does affect the pregnancy outcome. So in the men, using alcohol on a regular basis can increase the miscarriage rate and decreases the lower birth rate. Now look at the caffeine intake. Now this is a classic paper. More than 5 cups of coffee will reduce time required to become pregnant. 5 coffees. Did anybody tell you this? No. Means out of the tea and coffee, tea is better than the coffee. Depending upon whether, now I don't want to get into decaffeinated coffee and caffeinated, it's coffee. So you better stop coffee. I told you M for monkey. This is what is happening to our population. They come at the age of 38, married for 10 years, trying for 6 months. What were they doing? Planning. We were preparing, we were buying house. I wanted to go to Europe. I wanted to have 2 cars. Typical Mumbai patient. I am sure you also must be getting this kind of patient. Or some kind of financial problems or marital disharmony. So we know that above the age of 35, the age, this thing, the men were thinking very nicely that they were the ring in the finger. Finger becomes old, the ring remains the same. But it's not true now. With association of diabetes, obesity, hypertension, male also show a dramatic fall in the sperm count and decrease in the quality of the semen and the sperm, which will affect the outcome. But so we saw the age, stress. What is the stress? What is the stress? In our building, there is a COVID case. It's a stress for us, right? Simple stress. Huh? Our patient who conceived after 10 years has spotting. Now the consultant also has stress, patient also has stress. This is called stress. Before going to the office, when you are late for the meeting, what dialogues you are going inside your mind is all stress. Is increased sympathetic tone. You are increasing the cortisol. But are we aware? Are we bothered? Does it really affect us? At the moment, it's not. Like take pharma industry. If you take their stress levels on the sales closing day, the stress are very high. Isn't it? So there are 2 ways of stress. One is non-epinephrine and one is cortisol. Non-epinephrine directly through the brain and cortisol is through the adrenocortical axis. And this is how it affects. I told you, loss of libido. First, ovarian maturation, ovarian cyst formation, implantation, all affecting hormone levels. Now there is sympathetic and parasympathetic. Okay, sympathetic and parasympathetic means what? Sympathetic is high adrenaline drive. You come to OPD, you are 10 minutes late, there are 30 patients waiting. What are you doing? You are trying to finish all 30 by 3 o'clock because you have to go for managing committee meeting of Calcutta. Right? So what you are doing? Finishing. Stress in you. And parasympathetic is, do we know when did we do parasympathetic stimulation? When did we sit in the meditation? Did we give attention onto our breath anytime? To be in the present moment. We are either in the past or either in the future, not in the present moment. So this is how the chronic stress. So what we are seeing today is chronic fatigue syndrome. And this is the hypothalamo-pituitary axis, increased cortisol in the blood leading to increased salivary cortisol, coronary spasms and disorders of different kinds. And acute on chronic is the month-end sale. This is how it affects your quality of oocyte, oxidative stress, reduction in the oocyte quality and egg production. Rising stress can be because of anything. You know, yesterday the Sensex fell down by 1,400 points. Stress, rising stress, petrol prices are rising, and because of the COVID time now, people have lost their jobs. There is a rise in the petrol prices. It doesn't come to us, but it is reaching our patients. They have no jobs, but they don't have child also. So how are they going to manage? Then they come to you. Now the problem is, infertility treatment from the word go is a very stressful treatment. What do we told them? You have to do so many tests, spend money. You have to take so many medicines. When the report comes, you tell them, see your count is very bad. See your ovulation, it doesn't happen. You don't give them hope at all. This was, my friend Gautam was telling, hope. Hope counseling is completely missing. What we are telling them is always bad news and bad news. Your endometrium is thin. So what to do with that? We do not have time for that. We know only to give estrogen to them. And that will improve the endometrium. That's all. When I remember there was one IVF specialist where the scan used to be done at one center. They have to go and meet the doctor in the second center, go to the third center and take the injection, and then they go home. And this would be followed throughout the IVF cycle. Means the job is gone for a toss. So typically what happens, they plan their career, bright career, then they plan the pregnancy, then they want to do the obstetric career, then they take a break from the career and plan the obstetric career. By the time they are 37, now the pregnancy is also not happening and career also not happening. And the entire family is stressed. The mother, father, everybody is stressed. We never go beyond our patient. What is happening inside their family, we never go and ask. Because our job is what? Make them pregnant and refer it to a gynecologist who refers patients to us. So he is happy, I am happy. Out of the picture, everything is going well. Whether this is causing this and this causing this, we don't know. World War II, World War I told us, COVID also told us, high amount of stress, but infertility did not happen. But because there is infertility, there is definitely stress because of expectations. And whenever there is a lack of expectation, this is going to happen. So we saw that impact is going to happen during the fertile window. When you want to do an IUI, you look at the amount of semen quantity. Normally, I look at the quantity of semen given is 1 to 1.5 ml. not like a regular ejaculate. During IVF also, hardly any ejaculate. Nobody has done the studies, but this is how we are supposed to manage the patient: cognitive, emotional therapy, rational therapy, throughout the IVF cycle, before treatment, during treatment, and after treatment. Now, once we do embryo transfer, what do we do? What do we do? The best thing is we don't do anything. Are we supposed to do anything? Yes, a simple phone call maybe would help for them to understand. And they are taking bed rest. So what they are doing 24/7, is it going to happen? Not going to happen. Is it going to happen? Not going to happen. They cough, they sneeze, they pick up something, and then they feel, is it going to affect? Is it not going to affect? We know that it's not going to affect at all. So counseling, this is the purpose of the counseling, support group, therapeutic counseling. Problem is this: when you tell a patient that you need to go for psychological counseling, two things happens. First, they will cancel the appointment at the last moment. Second, they will change you as an IVF specialist, because they feel they are relatively better. What is the point in going to psychological counseling? Now, psychological counseling is another part where they do not understand IVF at all, what we are working. And we don't know how to do the counseling because we have never done a counseling course. उठ के बैठ गए सीट पे और लगता है हमें काउंसलिंग आ जाता है, जैसे वेट लॉस है, अपने को तो सब आता है, काउंसलिंग भी आता है, सब आता है. The problem is there that this gap is never going to be fulfilled. This is how the lifestyle management is going to happen. Preconceptional counseling is going to be very, very useful. Educating the patient of negative impact of obesity and on fertility. Mental health care about weight loss. Well, it's easy to say because I'm saying it now, but it's very difficult to do it. Motivating the patient is very difficult, require considerable time and effort, which we do not have. Trust me, we do not have. Because we need that 30, 40, 50 patients in the OPD. It's not like Europe, where they see only 6 patients. And they feel, when they see 8 patients, oh, OPD became heavy. But for us, it's like 50 patients and they feel, their adrenaline drive is good. And the patient-centric approach has to be good. Not it is the batch-centric or the IVF-centric. Am I going to finish 40 cycles? Am I going to finish my target? And individual healthcare plan, which is something very important. These are the level of lifestyle recommendation options. Weight loss, if you add counseling with orlistat helps. Ayurvedic medicines, placida for reducing the stress management, ultra magnesium, all these things would help in improving the outcome. Now what happens if you are not available for counseling? What do the patient do? They go for relaxing therapy, massage therapy. In USA, they found 70% of the patient go for alternative medicine before coming to the IVF consultants. They try to find out, acupuncture, will it help? Will acupressure will help? Will Reiki help? Will yoga help? They try everything. If it doesn't work, they come back to you. Okay? Chinese herbal medicine and acupuncture has gained popularity in America also. Why? Because they have publications on it. Indian herbal medicines, no publications. You send it to a herbal medicine guy, he will give you same medicine for oligospermia or as well as erectile dysfunction. Everything is same. So, Ayurvedic medicines in India not doing so well. So, according to me, you need to identify the lifestyle factors. Counseling, you need this multi-specialty approach. Like Gautam said, if you have a patient who is 36-year-old, okay, elderly, his BMI is 32, she's got borderline blood pressure, husband is diabetic who is 45, okay, you do an IVF and transfer 2 embryos, okay. Now what happens? She develops PIH at 28 to 29 weeks. You do a cesarean for absent end diastolic flow. What happened? Baby went to NICU. Baby went to NICU till what weeks? 37 weeks of gestation. Our job is done, fine. Then what happens? The quality of that life of that patient is gone for a toss. Do we really look at this approach anytime? No. Because for us it's win-win. We have won the battle. Our pregnancy rate came, live birth rate happened, we are good. Long-term follow-up we never see. So, multi-centric approach, what we need to do according to me is, after so many years, is the healthy mother and the healthy child delivered in a healthy fashion. It should be our aim rather than looking at beta SCG report. According to me, we need to change our approach completely, and for which I feel single embryo transfer is one of the way forward. You don't do counseling, no lifestyle management, patient comes in, you take them for IVF, patient doesn't have child, patient goes through depression, divorce, failure, all which is continues in their life. This is one motivational video which I want you all to see.
เรามันเป็นตัวประหลาดใช่ไหมบนเขามีบ่อน้ำศักดิ์สิทธิ์ตำนานเล่าว่าผู้ใดแบกน้ำขึ้นไปเติมให้เต็มเทพเจ้าจะปรากฏมามอบพรวิเศษ
Number of days, and you see the win-win-win situation. Do we have this kind of example in our practice? Anytime a polycystic ovarian disease patient come, other than electrodes, have you really ever tried asking her to lose weight and come back after 6 months? Have you done that follow-up with the patient, given her exercise, what exercise to be done? Have you given orlistat? Have you looked at the post-glucose insulin of that patient, whether this patient is going to develop GDM? I think it's time for us to get up. I think its time has come. See, ART bill is on the way. And let me tell you, in ART bill, there is a very dangerous situation that there can be, we can go behind the bar for 10 years. This rule is coming. So we need to understand and start counseling our patients correctly. Because who will go against you, we never know. Because patient is going to be negative after the pregnancy rate is negative. They are going to find out the ways and means of doing it. It's going to be next new difficulty for us. So thank you very much.